Hello, I'm Jamie Parker. I'm doing my head-to-toe assessment for health assessment class. First of all, I've washed my hands, and I'm going to ask the patient if I can do a head-to-toe exam.
Yes.
Then I observe just overall head-to-toe. He looks normal and healthy. Now I'm going to assess his vital signs. Blood pressure is 132/82. Now I'm going to assess his pulse. And it's 80. I don't have a thermometer, so we're going to pretend I took his temperature, and it's within normal limits. Now I'm going to do height and weight. What is your height?
6'3",
And his weight is,
265.
and we're just going to chart that as stated. I do not have a scale or a height measurer. Now I'm going to assess his skin. Do you have any open wounds or sores anywhere? We're going to look at his back. Make sure. Okay, look at your legs. And there's no wounds. There's no edema or lesions noted. His skin turgor is good. He's well hydrated. Now we're going to check out his, we're going to start with his head. He has normal skin and hair growth. Smile for me. Face is symmetric. Stick out your tongue. Tongue is symmetric. Now we're going to palpate the temporal arteries. And they're both normal. There's no tenderness. I'm going to assess for T&J. Open your mouth and shut it. Open. Shut. No clicking. Okay. Now I'm going to assess his eyes and pretend to have a pen light. Look at my nose. Okay, they're reactive. Follow the pen. His eyes are perla. They're completely normal. Now we're going to assess his ears and pretend to have an otoscope. We're going to look at tympanic membrane, make sure it's shiny, gray appearance, no fluid or redness. They are normal. Assess this side. Again, it's normal. Okay, now we're going to inspect the nose. Any tenderness in the sinuses? Normal appearance, slight deviated to the left septum. We're going to inspect the inside of the nose, and it is normal. Now we're going to inspect his throat. Say ah. Tonsils are 1+. Lift your hand. Gums are normal, pink, and moist. And now we're going to inspect for JVD, which will be difficult to do on this bed, so we're just going to pretend. I need you to sit back. You sit on back at about a 30-degree angle and look for any distension, and there's no distension noted. Okay. Now I'm going to assess his breath sounds, heart sounds, and check for carotid bruits. We're going to do breath sounds first. Take a breath in and out. Good. Okay, now I'll do the posterior breath sounds. In and out. Good. Okay. All lobes are clear to auscultation. Now we're going to listen to heart sounds. He has S1, S2 heart sounds. I hear no murmurs, clicking. There's no crepitus. Now I'm going to listen to his carotids with the bell. Take a deep breath and hold it. Exhale. Deep breath and hold it. Exhale. There are no bruits noted. Now we are I'm going to palpate all of his arteries. I want you to take your shoes off. We're going to check his pedal pulses. And all pulses are 2+. Now we're going to do an abdominal assessment. I'm going to have you lay back. First, we inspect the abdomen, make sure there's no bruising. He has no scars. Now we're going to listen. He has active bowel sounds in all 4 quadrants. Now we are going to lightly palpate for any discomfort. Let me know of any pain. Okay. No pain. Now we're going to lightly palpate. Or percuss, I'm sorry. Okay, and that's normal. And that concludes my head-to-toe assessment.
You're doing great. Bye.